Today we are discussing Kerala University of Health Science Kuhs Community Medicine Paper 2, March 2024 question paper, March 2014, sorry, 2024, March 2014 question. So it is a essay, only the this Sujata is an 18-month essay, 10 mark, is an 18-month-old girl who is brought to you with a history of cough, breathing difficulty over the past 3 days. Answer the following. What are the danger signs that you would ask or look for? So it is an 18 months. So it is a uh, under 5 child with breathing difficulty, means acute respiratory illness or acute breathing difficulty. So not able to drink. So what you look for is, she is able to drink. What are the danger signs that you would ask for or look for? Not able to drink. Is she having convulsions, stridor, severe malnutrition, nasal flaring, then grunting, then fast breathing, that is more than 40%, just drawing. That are the danger signs we should look for. How will you classify the disease and on what basis? Classify into very severe pneumonia, and pneumonia. No pneumonia. Very severe pneumonia, not able to drink, convulsion is there, abnormally sleepy or difficulty to wake. Stridor, then stridor in calm child, severe in malnutrition will be. Severe pneumonia means nasal flaring will be there and grunting and cyanosis will be there. Pneumonia means only there will be fast breathing and no chest drawing. No pneumonia means cough, cold with no chest drawing. How will you treat? If there is at least one general danger sign, refer urgently to hospital after giving first dose of antibiotic, treat the fever and wheezing. So we have to refer to a first referral unit or a tertiary care hospital which have a ventilator support and all. Then it is a 5 mark problem based question. Suma, 6-year-old, is studying in a school of your PHC area. She presents with fever of 3 days duration. On examination, you find maculopapular rashes and some vesicles. The lesions are very distributed all over the trunk. As medical officer, how will you manage the situation? So chickenpox, measles or exanthematous fever is written as accurate diagnosis is not the priority here. So it is maybe chickenpox, or maculopapular rashes, chickenpox or measles. Symptomatic treatment. Conduct survey in your area and assess the immunization status. Ensure that all children are immunized up to the age. Educate the mothers regarding the second dose of measles, and all children have received the all dose of vitamin A prophylaxis. So the second dose of measles is at 15 months, and ensure that all children have received all doses of vitamin A prophylaxis also. Third question. As the medical officer of PSC, you are asked to prepare a project to improve the surface of the Anganwadis under your jurisdiction. Describe your project protocol. So objective to improve the service of Anganwadi, conduct a survey of Anganwadis regarding the status, assess the structure, manpower and the facilities available and the population to be catered to. If an Anganwadi has to cater to more than 1000 population, see to it that more Anganwadis are built. Plan a program. Find resources such as money, train manpower such as Anganwadi teachers and ayas, reinforce the structure, ensure adequate facilities, educate the people regarding sending their children to Anganwadi. So it is a collective effect. You have to find the expenditure, plan funds, you have to make it, you have to train the manpower, the Anganwadi teachers to be trained properly, the ayas to be trained, and we have to create a awareness among the community so that the people are sending their children to the Anganwadis to avail the services. Then short note question, 4 mark question, post exposure prophylaxis for category 2 animal bite. Post exposure prophylaxis for category 2 animal bite is anti-rabies vaccine, intradermal or intramuscular schedule. Intradermal schedule, that is the modified Thai regimen. Intradermal, DTP we will say. So it is the modified Thai. Dermal means it is Thai regimen, DTP. Like that you have to make a code. Dermal means it is Thai regimen. So it will be 0.1 ml on either arm on days 0378. 0, 3, 7 and 28 is 22202 or intramuscular schedule 0.5 ml on 1 arm on days 0, 3, 7, 14 and 28. Anti-rabies vaccine intramuscular means 0, 3, 0, 3, 7, 14, 28. Intramuscular means 0.5 ml on 1 arm. Anti-rabies vaccine intramuscular means 0.5 ml on 1 arm on days 0, 3, 7, 14, 28. Then the treatment of multibacillary leprosy in a child aged 12 years. Rifampicin 450 mg once a month under supervision. Dapsone 50 mg daily self-administered. Clofazimine 150 mg once a month supervised, and 50 mg every other day. For 50 mg rifampicin, dapsone is 50 mg. Even if the adult dose is written, give at least 2 marks. So clofazimine. Then behavior change communication in malaria. Change communication BCC can be used to educate people regarding symptoms of malaria, prevention of malaria through vector control, personal protection, etc. So it is we have to communicate in such a way that the people should change their behavior, and that will ultimately prevent them from capturing the malaria. That is the question the examiner has put in the question paper. So what we have to do? We have to educate people regarding the symptoms of malaria, prevention of malaria through vector control and personal protection, and factors engaging counterfeit drugs. High demand of medicines, low production cost, absence of legislation, poverty and lack of official supply chains. National guinea worm eradication program consists of safe drinking water supply, control of cyclops, education of public in matters regarding boiling, sieving, surveillance, treatment of cases with nirindazole, mebendazole, etc. Differentiate between Vivax and falciparum malaria. Plasmodium vivax treatment consists of chloroquine 25 mg per kg divided in 3 days and primaquine 15 mg for 14 days. Plasmodium falciparum means we will use ACT combination therapy and primaquine. There it is chloroquine, it is primaquine, and for ACT combination therapy 45 mg on second day. What is monitoring and evaluation? Monitoring means the performance and analysis of routine measurements aimed at detecting the changes in the environment or health status of the population. So, monitoring means the performance and analysis of routine measurements aimed at detecting the changes in the environment or health status of. Evaluation means it is process by which results are compared with the intended objectives. Kwashiorkor and marasmus. Both are protein energy malnutrition. In Kwashiorkor, the muscle wasting is hidden by edema. In Kwashiorkor, the muscle wasting is hidden by edema. Fat retained but not firm. Edema present in lower leg, face and forearm. Weight for height low may be masked by edema. Irritable, moaning and apathetic will be the child. Kwashiorkor. Marasmus means muscle wasting is obvious. Severe loss of subcutaneous fat. No edema. Weight for height very low. Mental changes sometimes quiet and apathetic. So, Kwashiorkor and marasmus both are protein energy malnutrition disease. In Kwashiorkor, muscle wasting is hidden by edema. Fat is retained but not firm. Edema is present in lower leg, face and forearms. Weight for height is low, may be masked by edema, irritable morning and apathetic. Marasmus means the muscle wasting is obvious, severe loss of subcutaneous fat, no edema. Weight for height is very low, mental changes sometimes quiet and apathetic. Then fluorine is a double-edged sword. Prolonged ingestion of fluorine associated with the dental and skeletal fluorosis. Inadequate intake with the dental caries. Then blanket treatment is essential for control of trachoma. If mass treatment has been written, can be given if a prevalence of more than 5% severe or more trachoma in children is an indication of mass or blanket treatment. It consists of application of twice daily of tetracycline, 1% owing to all children for 5 consecutive days of each month, or once daily for 10 days each month for 6 consecutive months or 60 consecutive days. It is an alternative antibiotic is erythromycin. So for trachoma we are using 1% tetracycline ointment to all children. For 5 consecutive days each month for 6 consecutive months. The facilities under CGHS. Steps in planning cycle, data collection. Steps in planning cycle, data collection, analysis, formulation of problems, prioritize among objectives, plan, implement, evaluate. Data collection, then analysis, formulation of the problem, prioritize the objectives, prioritize among objectives, plan, implement and evaluate. Control measures against industrial cancer. Exclusion of carcinogen from industry, well-designed building, medical examination, inspection of factories, patient hygiene, licensing of the establishments. Ways of acculturation. Ways of trade and commerce, industrialization, trade and commerce, industrialization, propagation of religion, education, conquest. Culturation is through trade and commerce. Industrialization, there will be propagation of division, education and conquest. Conditions for medical termination of pregnancy, medical, eugenic, humanitarian, socio-economic, failure of the contraceptive device. So, medical, eugenic, humanitarian, medical, socio-economic, eugenic, humanitarian. Next question paper we will be discussing later. Thank you. Have a nice day.